So welcome everyone to this webinar on climate change, urbanization, and the future of rural health. And this is one of the most important topic of our Global Rural Health Summit. This is one of the key sub-theme for this summit areas. And here, the idea of this pre-summit webinar is to explore the topic in detail, to get ideas for the manuscript for the position paper, which we are drafting for the Global Rural Health Summit. And this will help us to understand your views, your context, and so that we can incorporate all the suggestions in our manuscript. So I'll open this webinar with a round of introduction, and I'll begin with myself. I am Pratyush Kumar, and I am the chair of Wonka Rural South Asia and the chair-elect for the Rural Wonka, which is the Wonka Working Party on Rural Practice and the convener of this Global Rural Health Summit. Next, I'll invite Sanka. Can you listen? Can you hear?
Yeah. Thanks, Pratyush. I'm Sanka. I'm a family physician from Sri Lanka and also the chair-elect of Wonka Working Party on Planetary Health. Thank you.
Thank you. Austin? It's not there. Dr. Anshu?
Hello, everybody. I'm Anshu. I'm a pathologist from the Mahatma Gandhi Institute of Medical Sciences, Sevagram. I'm also on the board of directors as the Southeast Asia representative of the Network Towards Unity for Health, or the TUF. So I'm here in that capacity.
Thank you. Thank you. Yogesh Jain?
Hi, I'm Yogesh Jain. I'm a public health physician and an activist in rural central India, working here for the last 25 odd years in central India. Thanks.
Thank you. Thank you. Anna Perez? Okay. Marilena? Anyone?
Hello,
Devanto?
this is
Yeah.
Marilena Anastasaki. Yes,
Yeah,
I
please.
am from Public Health and Epidemiology researcher at the University of Crete, Greece, and a member of the Wonka Working Party on Mental Health. Thank you.
Thank you. Thank you. Mr. Buckland? Buckland?
Good morning. I'm Aldith
Yeah.
Buckland from Jamaica in the West Indies. I'm pleased to be at this group. I belong to the Caribbean College of Family Physicians, and I'm just excited to be part of this. Thank you.
Thank you. Thank you. Devanto?
Yes, good evening from Indonesia. I'm Dewanto. I'm a family medicine trainee. Currently, I'm working as a physician in a rural hospital in Bandar Lampung, Indonesia. Nice to meet you all.
Thank you. Mandisa?
Hello, everyone. My name is Dr. Mandisa Tenero. I recently graduated as a family physician in October. I'm doing MPhil with Stellenbosch. I'm in Botswana. Nice to meet you all.
Thank you. Thank you. And we have anyone else who would like to introduce themselves? I think Christos has joined just now. So Christos, your introduction, please. You're at the right time.
Thank you very much. Apologies for a few minutes. Christos Leonis, University of Crete Medical Faculty and the chair of Working Party on Mental Health. Thank you.
Thank you. So we'll begin this webinar with an opening remark from Sanka. So that can you please give a brief overview of the climate change, urbanization, and yeah, go ahead.
Thank you, Pratyush. Sorry. Is there anyone else to introduce yourself? No, it should be this. Thanks, Pratyush. Sorry for not switching on my video. Actually, even I switch on my video, you will just see the darkness only because I'm in a power cut in Sri Lanka. The 2 days back, we had some sudden unexpected power failure. As a result, one of the powerhouses has been disrupted, and we have 2 days of power cut. So today, unfortunately, it had fallen to the same time, and also
That's
probably
perfectly rural. Don't need to
rural
worry about that.
plus more or less a result of climate change as well. So if I start with, yes, so we are our topic more or less is climate change, urbanization, and future of rural health in low and middle income countries. So climate change and urbanization are both are significant global trends, and both are impacting human health, especially when you take low and middle income countries, as you all know. It is believed that usually urbanization brings economic growth and also improve access to services. But the problem is it can also exacerbate health disparities, especially when it goes with adverse effects of climate change. When you take rural communities or rural population, especially in the low middle income countries or LMICs, they are uniquely vulnerable. So there will be a lot of challenges, such as limited healthcare infrastructure, increased exposure to climate-related hazards, and also the migration of healthcare professionals to urban areas. So what we need, or what we are going to examine in our paper would be what the background of all these problems, and then also what is the real problem, where is the real problem, and then we would be also looking into the research gap, and we would be proposing some solution and possible strategies, and finally also some policy recommendations. I think it's important when I look into my colleagues who have joined us today. We can see most of your uh, special interest areas and your expertise is very important in this topic. Mental health, I don't want to stress again how important mental health is, and how climate change and mental health is very much related. And I heard one of my colleagues here is a pathologist. When we discuss about planetary health, we also know how important to discuss about unnecessary referrals and unnecessary investigations, and the carbon footprint occurs due to referrals and investigations. So the rational referral systems and investigations, how important they are. So I think most of you who are here are very much important when we are discussing this topic. Pratyush, I would like to stop here and save
Yeah.
my battery as well as my probably network to listen to the entire webinar. Thank you.
Thank you. Thank you. That's very efficient of you. So I'll bring Dr. Yogesh Jain, who is a public health researcher and renowned person in India. That what's his views on urbanization and the future of rural health, basically.
I think, really, when it comes to urbanization and how it relates to, climate change, the the specific thing I can mention is that in the context of excessive heat, that is the most important component of climate change that in my work, I find that as the major, major sort of, component of that climate change effect that we see. I realize that, urban communities are far more vulnerable as well as less prepared and even not even keen to be prepared for how to handle excessive heat situation that we in central India, as well as some other parts of India, have been facing over the last few years. Every year is warmer than the previous year in the last
Yeah.
few years, and the urban I see that rural communities are more easily able to adjust to some excessive heat conditions by changing their work patterns. If there is some if there is some agricultural work to be done, they would start at 4 or 5 a.m. in the morning. Or if there is some ground earth work that is to be done, it is done at hours which avoids the peak 9 to the 10 o'clock to about 2 o'clock time, 10 a.m. to 2 p.m. time, which urban communities, because the way they are structured around the markets, the offices, and the entire work pattern is so structured to be peaking during the peak hours of heat, that they are clearly, they jeopardize the health of the people, and usually the poorer people who make an earning out of a daily wage, who make out of the daily work that they would do. So I can, in that context, say that any more of urbanization would be disastrous than what we have been doing. And in any case, the second component is that most poor people in urban India, if not other parts of the world, are usually the rural poor who migrated to the urban areas and stay in shanties or slums, if I may call them. And those places have now notorious for becoming, urban heat islands, where night temperatures would be even higher than by several degrees Celsius compared to the outside temperatures, ambient temperatures at that time, in the nights. So we can, as empirically, one can see the consequences of such major heat effects in urban areas in terms of both maternal and newborn health, with large number of preterm births or stillbirths, and newborn deaths, not to add to the increasing proportion of low birth weight babies. But and surely, mental health problems is something to be seen. And since this the other impact, I would say, is climate change, excessive heat impact of it has been clearly seen to increase all cause mortality in women more than men. So this is clearly a gendered thing that needs to be brought out, much more so in urban areas, if I may say. And but this is not to say how it would impact on rural areas. As I can see, we have been trying to understand how rural communities, in fact, understand what climate change and particularly excessive heat is.
Okay.
How is it impacted on their lives, that
Mhm.
people should be
Okay.
discussing and deliberating upon it, rather than be told by an urban or a networking organization telling people that no, there is a climate change like thing happening. I think we were trying to sort of get people to actually plan their own lives in a way, in rural areas, to understand the impact of excessive heat. And that has been a learning experience. People can observe, if there is a good discussion happening, how it is already impacting people or their lives, and to be prepared for future. Um, and but this is clearly would say, our health systems, as we have realized in rural areas, are
Mhm.
clearly unprepared for handling excessive heat, or forget about other difficult aspects of climate change, like floods
Okay.
or droughts and thing.
Yeah.
The
So,
urban areas, sorry, I would stop here, if not just to,
no,
I could go on about other things, but
I just
I'll
have a
stop here.
question
Yeah.
that there are few things, few important things you brought out, like adaptability and flexibility for the rural population. And in so many years of your practice, and you've seen lots in rural areas, uh, access is one of the most important thing which defines rural areas. Like if I have to ask what's rural, then access will always be in the definition. Uh, Regarding this, uh, access to healthcare services, access to resources, access is something which is very keen to rural. With urbanization, in the metros and cities, and what were villages some 10 years back is now a part of urban city. Uh, what changed in the landscape has changed in, like what impact the urbanization has been into your practice and the practice of, in the general public, in what they expect from the doctors thinking of urbanization and in terms of access.
So, if you're talking about only climate change and its consequences,
Mhm.
then
Urbanization,
urbanization
urbanization,
as it relates to climate change, or all aspects of climate of urbanization. Are you
all aspects of urbanization, if I have
okay?
to.
So, urbanization, the way we, I would say, not that I've worked much in urban health, but urban poor are actually the rural poor who have migrated from
Okay.
from rural areas, and they suffer the consequences of broken communities. One, where there is no relationships between people who are who are sort of sandwiched together, close to each other. Obviously, the
Mm-hmm.
problem of space is there in the urban areas, that people who come back from urban areas tell us in rural areas. But the other things, when you talk about access to healthcare or other services, other social services, I think there is a mirage there. There is certainly an availability to some healthcare, easier, at least in bigger metro towns where there is some semblance of public health systems functioning, unlike the smaller towns and rural areas. But the quality is a huge issue still there, and particularly in the context of managing excessive heat conditions. We in our work in urban central India, it shows that the hospitals are completely ill prepared to handle consequences of excessive heat. For example, labor rooms don't have coolers or air conditioners, because pregnant women are actually heat generators, no, because they have a baby also who are generating heat, and that is. But otherwise also, and there is, if you now, I remember 40 years ago when I was or 50 years ago when I was a little child, I could get ice from the market. I could go across and get, in the absence of refrigerators, one could buy ice across the counter in the market. These days, you don't have ice factories now. So if you have to handle a heat stroke where you require to bring down temperatures suddenly, those possibilities are just not there in urban areas, in most urban areas outside the big metros that we know of. And we know that refrigerators would only have about a kilo or 2 kilos of rice of ice, which would be not enough for more than one or two patients if in a hospital like thing. So I would say the issue about access may be achieved to some extent, to some quality, as some public health systems or health systems also, but those qualities are clearly
Okay.
clearly in question. But the other consequences of urbanization, which means broken societies,
Mm-hmm.
poor sanitation, poor other social services like feeding, the nutrition programs are clearly less accessible in rural areas, in urban areas than in rural areas. So I think
Right.
it's a double whammy in a way, being in an urban area for rural people. Over.
I
Yeah.
think it has impacted the rain, agriculture, everything. So
Yeah.
I'll go back to other delegate participants. I'll take the opinion from different countries. I'll bring back Christos. What's your opinion? What do you see in Greece, the urbanization and the
Um,
climate change?
I think that's very important, of course, listening all the people and especially the younger people, because suffering, that's one of the dimension of the suffering is that's especially the young population that's looking on a climate change and a natural disaster. and that's enhancing their suffering. That already many colleagues are mentioning that one of the major impact of climate change is mental health. And started mental health in the longer term basis, and also through the mental health issue mechanism potentially enhancing the chronic diseases. For instance, psychosocial determinants at the moment of cardiovascular disease are coming back with continuous and long-term suffering, which actually leading to depression and etc. But I'm thinking that is very, very important also just consider also the acute consequences, immediately consequences of climate change after especially a natural disaster, which has the impact on communicable diseases. At the moment, that's is a serious impact and long term, of course, the chronic diseases. But and closing, the most important is especially impact on low middle settings, especially because exacerbating and enhancing the poverty. And the poverty is the strongest at the moment determinant of health, especially in the rural areas and also low middle countries. And I think in that such a relationship with the poverty needed to be especially discussed and potentially also as Dr. Kumar you suggested, it is important also saying what type of a doctor and health team now we need it, especially in handling the people they suffering by understanding of the climate change or affected by natural disasters. And the other, and of course now I'm seeing that also Dr. Anasasaki is here. I think that is the important in enhancing the integration of public health with the primary care, and especially giving also potentially more focus on mental health. I think that many thanks giving a chance in a little bit saying my thoughts. Thank you.
Yeah, you have brought some very important points regarding mental health issues. And I believe that there's also something social determinants of health that plays a very unique role in exacerbating those things like poverty, education, sanitation. These things are really very important. And as a family doctor, what do you see your role as something who can mitigate these challenges? What could be the probable solutions to overcome these challenges? How we can reduce the mortality and morbidity in our community?
As among the people who seniors at the moment, since I'm old man, I'm thinking now always thinking the actions needed to support further the young generation. We just having an understanding that the world is changing, and potentially it's just supporting, alleviating the suffering, and the family doctors giving another dimension of so-called a meaning of the life. The meaning of the life now, I think that is a key role of family physicians. But I think that now Dr. Anasasaki has potentially
Yeah,
more important
thank
than
you.
me in saying to you. Thank you.
Thank you. Marilena, your views on
Mm,
this?
Hello. Without being an expert, but I think that in the frame of potential solutions that we can provide to the readers
Mm-hmm.
and to family physicians is how to make their practices and their practice in general greener, and how to support them in becoming resilient towards the big issues that climate change brings, including mental health issues, including how to protect their patients from the effects of climate change and extreme heat. So I suppose that looking at the existing best practices on how to make practice greener and more climate friendly, let's say, and resilient would be an important focus of the paper. So
Yeah, very nice point. Can you just give us a model in your country of any greener healthcare center which is there in your center, and what includes in that setup?
Yeah, unfortunately, there has not been such a model in our country. It's something that I have seen from abroad. That's why I'm not an expert on that. But from my experience in European organizations and conferences that I have attended, there are
Mhm.
ways to engage practitioners as well as communities in creating greener environments, healthcare environments. This
Yeah.
includes actions like from plant, from how to say, putting the plants around the facility to engaging in more like concrete actions. So, or in finding cost-effective solutions for
Okay.
diagnosis and treating diseases which are affordable and accessible and more green, let's
Okay.
say, environment
Thank you.
friendly. So I
Okay.
can look further on that because, as I said, that's what I've seen from going around Europe and within the scientific society, because we have nothing like that in Greece,
Okay.
particularly in Crete, where I come from, with the big rural community. But I can look more for that, and it's a suggestion for us to explore.
Thank you. Thank you. Dr. Anshu, I think you stay there in MJMS, which is something much more greener and what we call a perfect solution you must be having there.
There are no perfect solutions anywhere, but I was just thinking if we could take a few case studies, like for in the Indian subcontinent, you look at Bangladesh, the sea level is rising there, and in a fifth of Bangladesh land is likely to be submerged by the end of this century. So this kind of thing, we've already started seeing the impact of this. What is
Mhm.
happening is that there are people from China, India, Bangladesh who all rely on the water there. And even now, we are seeing there is because the sea is encroaching into the groundwater, there is decreased availability of water. The water quality is variable. We see drought and flood at the same time. Riverbank erosion is seen. And the impact, as Dr. Yogesh said, is that people from the coastline are migrating to Dhaka, or then again, either way, migrating towards Assam. So it's a simple thing like climate change can lead to world wars where the next crisis is going to be because of water. That's one example we can give. The second big example is that of the global warming in the Himalayas, where because of the melting of the glaciers, we're already seeing climate related hazards. We are seeing
Mhm.
avalanches, we are seeing flash floods, we're seeing
Mhm.
landslides, and this kind of disaster is happening, and eventually at least 8 countries are affected by all of this. Since I have a background in medical education, I do not know how many of our students understand how to handle disaster in this way. Global warming, of course, is one of the major problems that we have, and so everything that Dr. Yogesh talked about, extreme heat, is important. Also the consequences of climate change in health. We
Mhm.
have increasing temperatures leading and worsened air quality. The ozone layer is damaged, and then you have particulate matter, higher pollen counts. So all of this, which we have been discussing here, premature death, cardiovascular disease, respiratory disease, all of that is there. Floods. So again, drowning, mental illness, we have already talked about. Gastrointestinal disease is there. Vector-borne illness is another important area which we haven't talked about here,
Mhm.
especially Lyme disease and all. We expect tick activity to go up. We are seeing this kind of diseases entering, and water-related infections, food-related infections, salmonella again, outbreaks expected, and of course, mental well-being. So. One thing we could also talk about is the concept of colonialism. I don't know if it becomes a part of it, because major we used to live in harmony with nature. That was the, if you look at the Asian subcontinent, we used to always live in harmony with nature. Now, with looking at the West, what we have started is simply copying the industrialized cities And as a result, uh, we have been pushed to poverty and more vulnerability. So while most of the initial phase, the climate change came from the West, we are bearing the brunt of uh, and the consequences of climate change more than the West. I mean, it's easy to make it a blame game, but um, do we have the resources to actually fight um climate change without the support of those who actually cause 90% of the problem? Um,
Right.
there are a number of changes there. I was listening to what Marilena said about how we can respond to this crisis. There can be different ways in reducing carbon emissions. There are two basic strategies which literature talks about. One is mitigation, and the second is adaptation. When you say mitigation, it deals with those actions which limit the causes. And this could be like using renewable energy, making our industrial processes efficient, using eco friendly transportation, and increase in the urban green areas and all of that. When you talk about adaptation, it is how communities can react or adjust to climate change. And this means developing more resilient agricultural species from the point of medicine, entomological surveillance, especially with vector-borne diseases coming around. So that part, how we can change our urban spaces by building maybe flood barriers, how we can delimit the coastal risk areas. So there's lots of literature on this, and if you want, I can take it out and share it with you. We can talk about it in two terms. One is what is the collective responsibility of governments, and second, what is the individual responsibility. So when you look at the leadership of the governments and how they need to practice or implement low carbon practices, how they need to encourage renewable energy resources, reforestation, biodiversity, preservation of that, and ecosystems, all of that is important. As part of individuals who act, again, the same principles of reduce, reuse, recycle, how we can use energy efficient appliances when we turn off lights, and how we reduce our carbon imprints. So basically, it's like it needs a lot of collaborative effort. And if in this paper you're going to talk about rural health in particular, I think we need to focus on the real impact now, what we can do here, and also, since I have an interest here, how do we train the future generation of doctors to be more aware of and more train them so that they can battle these causes. That's all I have to say about.
Um, I think you have very nicely summarized most of the things which we want to cover in our paper. And basically, it's always been like that developed nation are more industrialized. The progress we have always compared with urbanization. But I think there have been some after effects of all these growth and rapid urbanization. And gradually, we are witnessing all those changes. And we would like to take someone from Keshwan. Can you hear us? He's from Fiji and it's an island nation. And usually those island nations are mostly affected because of climate change. And uh, anyone else is here? Like I can see the message from Devanto. Can you hear us?
Yeah.
Yeah. What's your views? What do you see in your country regarding climate change?
Yeah, well, I'm from Indonesia, so it's kind of an island nation too. So, but we're kind of in between. Well, the rural areas are still considered low middle income, but the more urban areas, such as the island of Java and especially Jakarta, is already upper middle income economy by World Bank standard. So uh, we're in between those two. But in my area, it's still LMIC. So well, based on the research that I have done for
Mhm.
helping writing the background of the paper, I found a few things that maybe Dr. The other Dr. Ansha already mentioned it before, but let me just um, uh, read the notes that I have. So the first thing is the climate change and the emerging health threats is that the impact of the climate change on mental health, especially in communities affected by the displacement, food insecurity, and also extreme weather events. Um, Maybe flooding, yeah, and then natural disasters, and then also the role in this climate change increasing antimicrobial resistance, yeah, and to the
Right.
rising temperatures, water contaminations by industries, and also disrupted the healthcare access because the microbes are already resistant to the antibiotics. And then also the growing threats of the vector-borne disease has been uh, um, told by the other people. So due to the climate-driven changes in ecosystem, sometimes I can still find people living high up in the mountains get dengue fever or even malaria because those the vectors can live in such a cold higher areas because it's warming up. And then the second thing is the rural health disparities and the healthcare gaps. So the in rural hospital sometimes they close down, and then the limited referral system limits the emergency care access. My friend who works in a really rural area in Lampung, uh, he works there. Uh, he works there like 24 hours a day, 7 days a week. And then a new doctor came to replace him. So and it's like really tiring things to do because there's currently no healthcare worker there. And there's no incentives and people serving in these rural areas. And also um sometimes people in those areas still believe in the traditional community-based medicine and mistrust the we as Western medicine doctors. And third thing is the urbanization and environmental health. Yeah, well, in rural area, um, uh, the maybe in the islands, yeah, around like Fiji or on smaller islands in Indonesia, it's more vulnerable because the sea level is rising, and then
Okay.
yeah,
Yeah.
okay, okay,
I
maybe
think you brought
that's all from me. I think that's okay.
Yeah,
Thank
yeah,
you.
that's fine. Yeah, I think you all have brought some very important point that is regarding the training, recruitment, and retention of healthcare workers. Has climate change, urbanization has influenced the training, recruitment, and retention, especially in rural areas? Because already the recruitment, there is huge gap between urban and rural areas in terms of health workforce. But has it further widened because of climate change, urbanization, and so it's all impacts. I'll bring in Dr. Yogesh Jain. Can you comment on this regarding the training, recruitment, and retention? Has it been impacted because of climate change?
Sorry, training and recruitment of?
Of healthcare workforce, like doctors, nurses in rural areas? Like because of
I
climate change, people are not going there, or if they are going there, they just stay for a few months, and because of climate change, they are not able to live there. Like, is it much more with urban areas, or is it much favorable for rural areas?
I won't say that. No, I don't think the fact that the climate change is happening and is impacting both urban and rural areas, that impacting on whether people will not move, will even be less inclined to go towards disadvantaged areas like urban, like rural areas. That I at least empirically, there's nothing. I don't observe any such thing. But the fact, as I was mentioning, is it's far more difficult to be temperature, excessive heat, sensitive, and to be rational and to be, to be
Okay.
adjusting to that in urban area, in rural areas. I don't think that is encouraging any rural work, any people to go more towards rural areas. No, no, not yet. No.
I thought that the good climate may attract more health workforce in rural areas.
I don't think so.
Yeah, I think that's a reality. Um, Dr. Anshu, your comment on this?
Actually, I don't think there is a direct link between climate change and the migration. I think the reason is because we train them in tertiary care facilities. So our doctors are used to having the best of investigations, the best of, supervision, all of that. And the moment you tell them to move to a rural area, the problem is that. One, they do not have supervision, and if they're stuck with something, they feel lonely. The second thing is, even if they know something, they do not have this equipment there. So it's a sort of learned helplessness which happens, which makes people. No, it's not a fulfilling kind of job when you go to a rural area and when you
Right.
cannot make an impact, even when you know something. So I don't think it's a direct impact of climate change there. But now, with the climate change, the kind of patterns of diseases that we are going to have are going to be different. And unless you're going to train our students differently, they're going to have even more trouble migrating to the rural areas. That's what I feel.
Yeah.
Well,
Yeah.
sorry, Pratyush, I think I just would like to add on to what, my colleague was mentioning. The fact that there is a link between climate change and migration overall is there. That's very firm evidence, and it's a global evidence in a way. A lot of this migration from Syria to Europe, as well as other migrations from one country to another, those clearly have been linked to climate change. But your question whether people are less
Rural.
likely to go from urban to rural areas, that I'm not able to say. Yeah.
Okay, okay. I think we have been advocating for immersive rural training, and recently the family medicine training has been started in district hospitals, and that is one way how we can expose people to younger people to family medicine and something of more of public health where there's comprehensive health training. And Wonka has also Wonka has it's there in the policy to host a green conference only. So this conference, which is going to happen in the Bangalore, will be a green conference, and they have got all the list what should be there in the green conference. I'll move on to next Keshwan. Can you hear us, Keshwan? Okay. Sana Javed, can you hear us? Okay. I'll go to Aldith Buckland. Yeah.
Hi, I'm from Jamaica. What everyone is saying is similar to what we're experiencing in Jamaica. We have seen a lot of urbanization. People are coming from rural areas and want a place to live in the city, and we see a lot of high-rise buildings being constructed. My issue with these high-rise buildings is that they are not climate friendly. They are literally looking like what you would see in the United States of America. And I think if buildings would have higher ceilings and wider spaces for windows, so we have ventilation, even when we get power cuts, which is so frequent, we can open up the windows so we can get through ventilation. Mm-hmm. And the higher ceilings, having a higher ceiling would make the place cooler. And then we need green spaces around these buildings. When you go to places like London, they have so much green space. I find that people They don't necessarily need to have they don't really need to have a kitchen. They can just go out and get something on the road and then eat in the park. And I think because the places, the rooms are getting smaller, we really need to look, the policymakers need to look at building climate-friendly buildings and also climate-friendly roads, because you're talking about the infrastructure that's going to bring water to the buildings and the sewage. You know what they do in Jamaica? Maybe they do it in your country. They're putting these pipes, the sewage pipes and the potable water pipes side by side under the roads. To me, and I've discussed it with Water Commission and they just blow it off. But to me, they suppose you have a disaster. Suppose there is a disaster, and then let's say an earthquake, or there is flooding, and then the repeated vibration of the vehicles on the road will loosen up the pipes, because it happens, and stinking smells, sewage water running on the roads, that is going to contaminate the water supply. But somehow the people that are in power don't get it. So I think it is now an issue where we need to actually, working in teams, now make an impact on the policymakers that things got to change. Because when we have these sewage things leaking, we can now anticipate health problems. So number one, the policymakers making climate action, climate-friendly buildings, higher ceilings, wide spaces for windows, cross ventilation, green spaces, so people's mental health be improved, and then having proper water and sewage. Yeah, and I think these pipes need to be under the sidewalk. The sidewalk needs to be slabbed, and if there is a problem, you lift the slabs, repair your pipes, and put back the slabs. That's my personal opinion. The other thing, like for us as doctors, we need to look at the medication we're prescribing, because sometimes people don't take their medication, and that's really leading to greenhouse gases as well, because they don't need it. And having people just lead healthy lifestyles. We need to have that conversation with our patients and a conversation with the government and policymakers. Yes.
Okay. So are you suggesting these things for the urban areas?
Yes.
So you want to have urban areas with all these things so that the climate change may not impact them that much what is currently impacting, right?
Dream about it. We got to dream about it so we can design it. You know, we have disasters last year. Last year we had Hurricane Beryl. There was so much flood. There was everything going on wrong, and then the power was disrupted for months.
Right.
Furthermore, you couldn't get telephone.
So I think what you're suggesting is urbanization, but with lots of climate sensitive. It should be like climate proof urbanization you're suggesting.
Precisely, exactly. Thank you so much. You said it right. Thank you.
Thank you. We'll move to Austin. So please go ahead and just tell us what's happening in your country and how you all are seeing climate change, urbanization.
Thank you very much. I was just the audience, but you made me one of the people who was just talking. Thank you so much. I agree with you and also with the other presenters who were talking about urbanization and also mental health and planetary health issues. The problem is maybe the identifying the people we are working with. When we look at in our communities, this is our families, and when we are talking about the family medicine discipline, in here there is family. So nobody is client. If we are clients, if we became as clients, so we are customers. If we are customers or client, that means we are consuming something. if the idea is only consuming, so at least if we couldn't change the policymakers or the people who are just staying at their chairs, at least maybe we can, as consumers, just press on to get the high quality, like what breathing, to breathe non-polluted air, for example, or to get the right prescription, or to live in a healthy world, because as a consumer or client, I should live, so consume more and more. If not, it will be another problem to just wheel all the wheels to get together. But as I said before, in our discipline, we never ever think people as client or consumers. They are our family. We are living in the same community. It doesn't matter if it is in Pakistan or in Turkey, in America, in wherever it is. It is a part of our family. As Pablo Neruda say, if you feel you are a person, human, not only feeling your pain or aches are important, you can also feel the one you never ever see with the face or face to face. This makes you human. For the planetary health and mental health, the same thing is happening. Lots of people has got cracked down with mental health issues, and also lots of people has got, for example, in my country, cardiac arrests. And some of them are because of the silent killer, air pollution, because there are lots of people has got thoracic or chest diseases, although they are not smoking, but they are breathing. And they need this. So the other part is with floating, and our member from Christos, our neighbor, Turkey and Greece are the neighbor countries. And in Santorini, you may know there is some earthquakes. So is it affecting on Greece? Of course not. It is affecting us too in Izmir. But with the earthquakes, we also feel that, I want to remind it too, asbestosis became another problem. Like what? When the earthquakes come, it doesn't choose to break down this building or that building. If it is vulnerable, it collapses down. It doesn't matter the age of the building. If it doesn't make good or well structured, it collapses. And at those times in Hatay, we find out that, oh, there are some old age buildings and they use asbestosis because at those times it wasn't burden for, or it wasn't restrictive. So for not only the ones who were living there, but also for the healthcare workers who are trying to help their people there, was affected too. So we will see the results later when this is an emergency, for example.
I think lots of urbanization has happened without much planning, and they're not climate proof. And I think people may not have expected that the climate change would be that much rapid and will bring so much of calamities very soon. Like in our lifetime, we have seen changes in the school where I used to go. Initially, when I entered the school, there was no fans because there was no need to fans. But when I was passing out, they had to install fans because that was the need of that time. And there have been rapid changes in the temperature and everything is impacting lots of people. Uh, I think this is an important thing which we need to discuss. And I'll just like to end the session and I'll take the opinion of this that as a healthcare professional, whether it be a family doctor, nurses, or any healthcare professional, where do you see yourself and what are the suggestions? What are the suggestions you would like to suggest to mitigate all the challenges which change is impacting? And what are the probable solutions? If you can just quickly suggest two or three changes which you'd like to suggest.
Well,
Azma?
as you may know about smoking sessions, because the night of this month was Stop Smoking Day, according to the World Health Organization. For the behavioral change, there are 5 steps. One is to be aware of something, and afterwards it just goes to make the true thing at the right time. But these 5 stages are differ from person to person and maybe from country to country. So the first one is, yes, something is going wrong. So if so, let's do something. Let's find the root reason, and we are not alone. We can do it all together, like to smoking sessions. The patient couldn't need to do it alone. We can help each other, and also we have got organization. One of them is you, for example. You are the chair of it, and also Wonka Planetary Health, and all together the Wonka is an umbrella, and World Health Organization could be too. So, and the other one is, if we do it together, it will help. I just want to remind you the fly in summertime. Let's think that you want to sleep. A fly will be a problem for you, although it is so little, all alone. And so, why should we all alone? We don't need to. We could be together and overcome these issues if we do it together.
Okay. Mandisa, I think you made a very nice comment on this regarding the role of family doctors. If you want, you can speak now.
I I typed, I forgot what I said, but I think one of the most important things as family doctors, we have links to many tiers of our health system: primary, secondary, tertiary, and quaternary. We can educate everyone, improve practices as well as attitudes. I think that would be one of the biggest steps in terms of climate change, because no one is here where we are. People aren't really interested in climate change, but it's affecting us very much. Yeah.
Right. Thank you. Shankha, can you just comment regarding and also the local perspective of Sri Lanka? What are the solutions you may suggest?
Yeah, thanks, Pratish. So I actually jotted down a few things that I would, go ahead with as a sort of a just an overview.
Okay.
A few
Go ahead.
strategies. One is strengthening rural healthcare systems, where we have to advocate the governments and the local governments to invest in rural healthcare infrastructure. This could include the training and retention of healthcare workers as well, which is very crucial. The second thing would be climate resilient agriculture practices. I think some of you have already mentioned that in your discussion, where we need to implement sustainable farming techniques, because rural areas, the main subsistence pattern, one of the main subsistence patterns is more or less farming. So climate resilient agriculture practices are very, very important. And the third one would be the integrated disease surveillance systems. Because, by establishing robust surveillance systems, we can monitor climate sensitive diseases, and then this could be used to facilitate early detection of response and to reduce morbidity and mortality associated with this community, especially the communicable diseases. And finally, it's all about community based adaptation strategies, like engaging local communities in developing and implementation adaptation methods to mitigate climate sorry climate related issues. So as family doctors, we all, as Mandisa was just mentioning, we all have some sort of a responsibility there, because as community based practitioners, the family doctors have a lot to do in individual basis, and as also, not only to our patients, also to the bodies, the local governments, the organization, through organizations where, just like organizations like Wonka, we can advocate to change policies. So it's all about policy advocacy as well, in addition. Thank you.
Thank you. Thank you. Sana Javed, if you can hear us, would like to give some comments on this. Ugozi, Buthelezi, if okay, Dr. Anshu, your final comments on the solution strategies, anything? Ugozi, can you hear us? Yeah. I think you've muted yourself.
Okay.
Yeah.
Yeah. Can you hear me now? Can you hear me?
Yes. Yes. Please go ahead.
Okay. Okay. I greet all. Yeah. Yes. As I'm speaking from Nigeria,
Okay.
practicing family medicine in the community. Okay, climate change. For us as family physicians, I know we are the center of it, the gatekeepers, and we truly have a big role to play in terms of advocacy in our communities. And then also, because where climate change is in our country, the awareness level as to how it affects health and changes disease patterns and severity, it's quite really low. And interestingly, even amongst us as practitioners, especially for our younger doctors, it's even interesting to know how ignorant many are as to how. So there's really so much work for me as a family physician. I'm doing my very little best, but there's so much for us family physicians to do in raising awareness amongst ourselves as family physicians practicing in rural communities, and also making the case why our governments or policymakers should be up to speed in terms of, somebody mentioned, sorry, I couldn't get the name, um, surveillance system, climate change surveillance systems. All government officials at various levels should really buy into that. They need to institute, clear-cut protocol, surveillance protocol for monitoring climate change and its effects in terms of how it affects health, generally. So for us, family physicians, yes, we are the center of it as far as health is concerned. I mean, climate change impinging on health. We are really should be at the center of it, and all of us should take it as a point of duty, as often as possible to speak about it. Because even amongst us as doctors, that is the surprising aspect of it. For younger ones, they don't seem, a good number of them are just, they're kind of bland, and well, so that's what I have to say.
Okay.
I've
Thank
learned a
you.
lot. Learned a lot. Thank you.
Thank you. Anyone
Yes.
else would like to speak? Okay. So thank you everyone for joining this webinar. It was really interesting to have your views on very different aspects of climate change, urbanization, rural health. We discussed lots of things regarding the education, awareness, surveillance system, adaptability, flexibility in the rural health areas. We discussed something regarding to migration, the morbidities, how it's affecting the social determinants of health, psychosocial determinants of health, mental health challenges. Lot of things we discussed regarding the social services, how it's impacting the social services, how it's increasing the temperature and affecting the water, sanitation, agriculture, everything we discussed in this webinar, and hopefully we'll incorporate all these suggestions into our position paper. Thank you all for joining this webinar from different parts of the world, and your views truly matters. Thank you. And we'll see you in our next webinar, and I'll just notify you with all the details, and I'll be sharing you the recorded video link very soon. Thank you. Thank you all.
Thank you. Thank you.